It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Dr. Nina, and welcome to another episode of Top Docs of Houston, the show that, of course, features some of the best doctors and procedures in the Houston area. And Dr. Nina, we're going to kick off the show with one doctor that has helped one individual lose a lot of weight.
Yes, he's one of the top bariatric surgeons in the Houston area. It's Dr. Robert Marvin.
We have young people who are already having thickening of their heart muscle. They're already not quite having normal function. And it's the earliest signs that there's a problem there, that the heart's working against a large extra load that it normally wouldn't have to.
When I originally started to even look into this after I talked to my friend, I was probably between 335 and 340. I'd been that for 10 or 15 years, been over 300 pounds for at least 15 or 20 years.
We're giving them back some of that control in that one area where they've had a problem. But it's a dangerous area. I mean, you can't walk around at 310 pounds and think everything's going to be okay for very long. It's not.
There's been times when I'd lost weight before, I've got down to 225 before, but 6 months later I'm back at 300, and that was always my issue. And after you do that 2 or 3 times, you know, why do you want to do it again? Because you know what's going to happen. I actually had a buddy of mine that did the surgery probably a year before I started looking into it, and he had had great results. His weight loss was incredible from what I'd seen, and I've known the guy for several years. And he was completely happy and excited with everything. So that's when I started looking into the surgery myself.
Buck has lost 115 pounds in about 6 months after having a sleeve gastrectomy. So I mean, that's a good outcome so far. We're only partway through. We're going to expect more weight loss beyond that, although he's clearly getting down towards his ideal body weight, which is where we'd really ideally like to have him.
I started off at 335 or 340, January of 2011, and it's February of 2012, and I'm at 186. It's like being reborn. Before, I guess I just kind of muddled through life. No excitement, just do what I had to do to get by, no energy, no fun. Now, I mean, the excitement, fun, romance, social life, things that I didn't have before. You changed my life. It's a whole new world every day.
Well, minimally invasive surgery, first of all, is very difficult to define. Nobody has a real definition of what does it really mean. Generally, there's smaller incisions compared to traditional techniques. There's less pain associated with that procedure postoperatively. Usually, one hallmark of it is a quicker recovery.
I had severe leg pain and lower back pain. I'd been to several different doctors and saw different orthopedic doctors, and of course ran the gamut with medications and all conservative treatments, and this is over the course of 5 years.
Typical patient that comes in looking for surgery with us have usually had physical therapy for at least one time of 6 weeks or longer. They've typically had symptoms for 6 months or longer.
I'm a busy person. I'm still fairly young, and I didn't want to take a year out of my life to recover. That's what really attracted me to Dr. Siddiqui.
What happens when they first come in is they get evaluated. We take a full history. We find out about their story, how long they've had symptoms, exactly what are their symptoms.
I actually had 2 different procedures done. One was the XLIF, which is fusing the L4 to the L5. The other procedure I had done was fusing the S1 to the L5. he went in through the side and removed the disc, and the second procedure was 1 week later. He went in the back and put in the hardware and the post from the S1 to the L5.
Rhonda is about 6 months following surgery now. She's taking little or no pain medications. She's walking around normally. She's had her physical therapy. She's able to return to a lot of the activities which she previously could not do.
It's hard to explain how I feel now compared to how I felt then. When you deal with long-term pain, and pretty much there was no hope for me. Once I started doing my own research and found Dr. Siddiqui, that was my ray of hope out there. I'm living proof that this procedure works.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to topdocsofhouston.com.
What I love about dermatology is that we do have the chance to change people's lives, whether it comes to detecting a skin cancer in a very early stage and saving a patient's life, or removing a skin lesion that was very disfiguring and giving them a great cosmetic outcome.
I had a spot on my nose that was frozen when I was at UTMB in Galveston, and I wanted to do a follow-up on that. I got in here and he discovered all sorts of basal cell carcinomas throughout my body.
I've known Mr. Lewis for about 2 years. He first came to me with a small skin cancer that we detected on his face, and unfortunately it was a basal cell skin cancer. Caught early enough, can be treated very easily with a great cosmetic outcome and almost no impact on a patient's quality of life.
I was fortunate to have Dr. Perri as a doctor because he's done a lot of preventative freezing, and he's done probably a half dozen skin surgeries so far.
Since then, he follows up with me very frequently because if you've had one basal cell skin cancer, it's very easy to develop more. You've had enough sun to cause that initial amount of sun damage to cause one skin cancer. So far, all of them have turned out excellent as they've been caught at an early stage of basal cell, and we've been able to treat them very effectively.
If anyone is out there and they have anything at all on their skin that does not look right, they need to come see Dr. Perri because they will receive the best of care.
If there's any concern on their skin, if there's a lesion that's growing, any change in color, size, shape, whatever, if it becomes symptomatic, even if it's a false alarm, go to a board-certified dermatologist right away, because if it's a skin cancer and it's detected early, it has excellent prognosis. So even if it's a false alarm, it can at least give you peace of mind that it's a normal skin lesion.
Dr. Perri is very astute, and he's able to pick up on a lot of things that are just not related to skin, but in other areas where I might need care. He has the best staff. These people are very, very kind and very, very courteous and helpful.
Depression is a very common and a very bad disease. It's different than sadness. Sadness is what happens when you go through bad times in life, and it just tends to come and go in all of our lives. Depression is an abnormality of the chemicals in the brain that brings on a lot of bad symptoms and often needs treatment with medications. The two main questions you should ask yourself to decide if you're depressed are these. Number one, have I felt hopeless and sad for most of the time in the past 2 or 3 months? And number two, have I lost my interest in those things that I usually get a charge out of doing? For example, ball games with the kids, movies, certain meals, certain things on TV. If you've lost your joy in life, that's a sign of depression, and it needs to be treated. What can you do about depression if you have it? Well, you can do a lot. You can take medication. There's a lot of medications that work, most with few side effects. Exercise helps, getting adequate sleep, and counseling also helps. So there's a lot of ways to go from sad to glad.
I was really scared, not knowing if that would ever happen for us, and it was starting to become a sensitivity. You know, we tell people all the time, I'm not shy to say, we used fertility to help us out, because I feel like people should not be scared or afraid or embarrassed.
It was clear that Melina and Jeremy wanted to try something less invasive than doing IVF.
What I noticed right off the bat with Dr. Witz is he would call me every day. We did a test, we did anything. I would get a phone call that night from his personal cell or from the office from him.
And when I talk about otherwise unexplained infertility, what we mean is that of the three things that are typically associated with fertility, ovulation, sperm count, and or sperm production and fallopian tubes, there wasn't anything that we could identify. And we did controlled ovarian hyperstimulation and did insemination, and my recollection is she got pregnant on the first cycle, and she was very happy about that. And did very well.
It worked, and we got through a couple of scares, and he was really on top of it. And instead of having quadruplets or sextuplets, I have one, which I was really happy about because one was more than enough to handle. But Gabriel's been a blessing. Ever since he was born, he has blessed Jeremy and I's life in more ways than I can imagine. A lot of people have said that to me, It was great from the get-go. Everything was so warm and informed, and I never felt left in the dark, or that I was just a number, or that I was a paycheck. You know what I mean? I felt like a person.
No, I think that the most rewarding thing is the patients who it's not been easy for, that come back and they're successful. That probably means the most.
He brings us a lot of joy, and we're a much healthier family and marriage and everything. It's been great. Can't wait to have a second.
Okay, now for more life-changing stories about some of the procedures you've seen on our show, please visit our website, topdocsofhouston.com.
Topdocsofhouston.com, the place to go to find the right doctor as well as the latest procedures. Right now, Dr. Nina, the place to go is our next top doctor, one of the best plastic surgeons in the Houston area. Here he is, Dr. Rivela.
Here at Rivela Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures, primarily of the breast, body, and face.
I was predisposed to like a droopy jawline, and so that began to be my focus when I looked at myself in the mirror.
Cheryl came to me with the concerns about her, again, the jowling area and deep lines on her face. She's a yoga instructor, and in particular the Bikram type of yoga where it's very hot, and I think she perspires a lot and is very thin, and she noticed her skin sagging. So to help her with that, we did what we call a mini facelift.
I talked to the staff first and then had a consultation with Dr. Rivela, and he recommended doing a mini lift. I felt like I was ready to do that, and just with some guidance and the questions that I asked and the way they were answered, I felt like it was a comfortable procedure for me to move forward with.
In general, most of the patients are women that come for a facelift. They're in their early to mid-50s. They have the signs of some jowls and what we call marionette lines. Those are lines that go down on each corner of the mouth. They have some wrinkled skin on their neck, and so that would be probably the ideal patient.
I'm only 3 weeks out of my surgery. I feel like, I'm really happy with the results.
Well, it's a good feeling to know that she now feels more confident, and she's of course smiling and very happy with the results, so of course I feel good about it.
I feel like that with the advice and the treatment and the service that I get at Rivela Plastic Surgery, I'm able to really maintain a level of confidence that allows me to get in front of people, and most of the time with no makeup on, and I feel really good about myself.
Pretty much allergies has been pretty much since I was born. And then I guess it really came in more in focus when I was diagnosed with asthma when I was 2 years old. And because my asthma is allergy triggered. And basically it's been pretty much a full battle since then.
In the case of asthma, what you have is an inflammation that takes place inside the lung. And this is a normal lung here, which is nice and pink and open. And when a person has an asthma attack, they have a muscle that just actually contracts, and it causes all of the inflammatory cells to come in, and the mucous membranes get very thickened, and over time they can actually become fibrotic and they're scarred. But the real important thing to notice is how red and angry it is compared to the other side.
You know, as a kid, back then, I just didn't have the knowledge or understanding of what was happening. It's just I knew it's like if I gone outside, did things, any activity, it was like my allergies start kicking in, then which then caused my asthma to trigger. I would really hinder my activity as a kid.
But I actually came into Kenny's life in 1997. He was 13 years old. And he weighed 285 pounds. And he was homeschooled, I believe, shortly thereafter because he was sick so much with his asthma that he, couldn't go to school.
Yeah, between the asthma and allergies, everything was just haywire. It's like literally we're trying different, combinations of meds every few months because just trying to find that right combination, and finally found that right combo, and it's been pretty good so far.
We got him well controlled, and now we're trying to put him on allergy shots so that we can eventually get him off the Xolair. And hopefully, with the weight loss and everything else, he will be on very little medication.
Especially with Dr. Dickens, she sits down, takes, walks you through everything. She takes, time. She doesn't rush you through, or you're not just a number. She really gets to know you, gets to know your history, and just that personal one-on-one that I don't see with other doctors.
What we want to do is try to help a woman get through this time frame with the intense symptomatology.
According to Dr. Meredith Morgan, intervention and management needs to be tailored to the level of severity.
For mild hot flashes, home remedy self-management techniques are effective. For some women, yoga will work. Other women, strenuous exercise. On average, you can't say that either one of them really works for everybody, but if it's good enough for an individual woman, it's good enough, and that's all she needs. There is a technique of breathing that's derived from transcendental meditation that actually has been studied quite a bit and found to be quite effective. There are two sets of data on the research, and there are different sets of outcomes and benefits and hazards involved in using hormones. In general, we try to start with a low dose and let the patient titrate up to a level that will produce a circulating estrogen level that's satisfactory for her response.
Now there are concerns with hormone therapy. What Dr. Morgan would like to point out is that there are three major concerns against the others.
First, breast cancer. Everybody's concerned about breast cancer. Second is heart attacks, and that's serious. But the most common one that we really address all the time is estrogen, and there's been very little historical interest. Your question was, what are we doing now as opposed to 10 years ago? We really haven't changed much in our concept about blood clots. For that reason, our preference is to try to use the non-pill forms of estrogen as much as possible. The pills go through the liver, and simply put, can increase blood clotting chemicals and the risk of blood clotting.
Now the most common question for most women for Dr. Morgan is, how will I know what I'm going to be confronted with? Well, the good news, according to Dr. Meredith Morgan, is that menopause is controllable.
Basic message I'd like you to get is there are many ways to approach this. This is not going to be incapacitating, it's controllable. Maybe that control is the goal, but we're not going to have terminal hot flashes.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable, and so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Kimberly was born with a facial birth defect until she met Dr. Michael Eisemann. Now she's a beautiful young girl. To find out more on Kimberly's story and other life-changing stories, log on to topdocsofhouston.com.
I was kind of up against the boards with the puck, and a player from the other team was coming in to body check me, and you just sort of brace yourself against the wall, and he literally just hit my elbow, and the boards were here, and it just popped. It didn't hurt right away, but I knew when he hit me, it was just an awkward feeling. Puck kind of went away from me, and as soon as I was out of the play, I pulled my glove off on the ice. And I looked down, and it was, at that time, my hand was sort of a couple inches over.
Imagine getting hit so hard that every ligament that holds your wrist in joint gets torn, and your wrist dislocates, pops completely out of joint. Those are very hard injuries to come back from, especially if you're a high-level athlete.
We have trainers and trainers' assistants and people like that that, have seen lots of injuries, and they were all just kind of like, oh boy. So I got the feeling that night it was sort of beyond sort of a physician that was at the game. And as an athlete, you're always thinking, well, is it serious enough that I can't play? And I found out it was serious enough that I wasn't going to play for a while.
But he came in with an unstable wrist that wasn't staying in joint, and we had to try and address that in order to get him back to activity, basically get him to be able to bear weight at all on that wrist again. When you get hit that hard and you get that much ligament damage, all the ligaments kind of fold over on each other and crumple together, and they're not in a good position to heal. In order to get this injury to heal, you have to rearrange everything and bring the ligaments back out in line so they can heal and get solid again. And we were able to do that in a minimally invasive technique through a little telescope in the wrist joint. And what we did was we realigned all of his ligaments, cleaned out all of the torn and dead tissue that was in his joint, and then put his joint back in place, and then put a pin across it just through the skin in order to hold it in place to allow all the ligaments to heal.
Scarring-wise and stuff like that, just incredible. Couldn't be happier. You wouldn't know if I didn't show you the other one, I guess.
It was a successful procedure, it was a successful recovery, and we accomplished our goals of giving him pain freedom.
My son is 7 years old, and he has really severe eczema. And because of that, he has battled with bad staph infections over the years.
His eczema became more severe over time, and it became what we call lichenified or thick. And so we were having difficulty controlling the atopic dermatitis, and secondarily, he was developing skin infections on top of the atopic dermatitis.
And about 8 months ago, he developed a really bad staph infection, and usually we can kind of keep it under control by doing bleach baths or just finally getting an antibiotic for it. So we had made an appointment with Dr. Ghali, his dermatologist, to go ahead and get an antibiotic. And when we went to see him, he said, before we do this, let me introduce you to this new product and have you try it out first before we have to do the antibiotics.
Beginning in May, we started to implement Seal-In Body Wash, which was a product that we were currently studying in atopic patients who had recurrent skin infections.
Actually, after a week of using it, I noticed his skin kind of was showing some improvements. It started clearing up. And then by the time we went and saw him 2 weeks later for our follow-up visit, Andon's skin was almost all the way clear. So we continued to use it, and now we use it about once a week just as a precaution. He can use the product himself. I don't kind of have to measure the bleach out, stuff like that. He just kind of does it in the shower. It lathers up like a soap. We can travel with it. We've taken a few vacations. You know, we just throw it in the suitcase with everything else.
He went from a very severe patient to more of a mild to moderate patient. And in the realm of atopic dermatitis, that is a huge improvement. And what it means to the family is that this child can sleep better. It also means to this family that the dynamics change in the house. Parents can often get the rest that they well deserve, and the kids can function in school a lot better.
His skin just continues to get clearer and clearer. And so far in the last 8 months, he has not had another breakout, and his skin has looks the best it's ever looked.
Our case example is Barbara, who was in her late 60s, who we operated on several months ago. And she was interested in removing some extra eyelid skin in her lower eyelid.
I've always wanted to have my eyes done, and he laid it all out. He explained to me what he was going to do.
Consider the eyelid and the forehead as one aesthetic unit. The cheek, the neck, and the jowl area we consider as another aesthetic unit. We do combine the surgeries, however, there are people who are just interested in having their face done or their eyelid done, but sometimes if you just do the eyelid and not the brow, they still have that hooded appearance.
He put me at ease, and I knew that he was going to do a good job, and he did.
She really wasn't too interested in actually in the upper eyelid being done, and was mainly so concerned about her lower lid, but we showed her some pictures before and after of people who had it done, and after seeing that, she agreed to have her upper eyelids done, and I was happy she decided to do that.
And after about 4 weeks, all the bruising was gone, most of the swelling was gone, and I was shocked at how great I looked. I really was. I hadn't expected the change to be so great, and I'm just really overwhelmed at how different I look.
It doesn't look like she's had surgery, which is what we're basically trying to achieve, is a natural look, nothing stylized. But she can recognize it, and that's the most important thing.
And I met a lady in the bathroom who works down the hall, and she said, "You look great. What did you do? What's different about you?" And I started laughing, and I said, "Oh, I got a new hairdo." I mean, I didn't tell her, but it's amazing, and it's happened 3 times. And he put me so at ease. That's really what helped me make my decision that I was going to go ahead and do my eyes. Well, this has really made me feel better about myself. And so I really am so glad I did it.
That's going to do it for this edition of Top Docs of Houston. Now don't forget, you can visit our website to learn about life-changing stories or some of our doctors at topdocsofhouston.com.
That is the place to go to find the right doctor and, of course, the latest procedures. And a reminder, if you have a question or comment for us, please send us an email at info@topdocsofhouston.com. That's info@topdocsofhouston.com. So long, everyone. We'll see you next week.